breast cancer detection solution, which is privacy aware, non-contact, non-invasive, early stage breast cancer or breast health abnormality detection solution. Our solution is able to detect abnormalities in the breast before even symptoms appear, before a lump or a discharge or any of the symptoms appear. It is non-contact, non-invasive. Nobody sees the person, nobody touches the person during the screening. So it's extremely privacy aware, where women do not have to shy away from disrobing in front of others. You just enter a booth, stay there for 5-10 minutes, and once you come out, your report can be done. And then nobody ever sees or touches the person during the test. It's completely radiation free, unlike some of the other tests where X-rays are used for screening. This just uses thermal imaging. So we just measure the temperature variations on the chest. It's completely radiation free and uses artificial intelligence to actually generate an accurate breast health assessment for the person. And because it is radiation free, the test can be done every year or every 6 months, depending on the risk. We also have a risk assessment service, which is available free of charge right now on niramai.org. We encourage all of you to take that and then take care of your health. Our solution works for women of all age groups, 18 years to 80 years. And it's very simple. It's just a 15-minute test, which will be conducted in hospitals, and the test is available in 14 different cities. However, because of COVID situation, because of the great demand of taking care of these diagnostics tests outside the hospital, we have recently launched a home screening service where anyone can actually register on our website or on any of our partners' apps like 1mg and ask for a screening to be done at home. This service is available in Bangalore, Hyderabad, and Mumbai today. It's also very affordable. It's 1/3 the cost of a mammogram. And because it is a light, small screening device, we are able to provide the solution at your place. The first ever time cancer screening is done at home. So without taking too much of your time, I will just play a short video, 1-minute video, which shows what the experience is, and then we go into the topic.
Recently, I lost a family member to breast cancer, and I know that as a woman, breast cancer is something that I have to keep checking myself for. Unfortunately, there's no way that is safe, reliable, and easy to find out about malignancy. While doing a lot of research and discussing this issue with my friends, one of them suggested the Niramai technology to me. Having heard about it, I went to get a checkup done. I was quite skeptical before I went for the test. It took me by surprise because the machines didn't touch me. It was all happening from far away. जैसे eye test होते हैं ना, दूर से बिल्कुल वैसा.
Yeah, so hope all of you take care of your health. And in order to enable you to do that, we are very happy to present our expert speaker, Dr. Sandhya Ravi ma'am, who is a consultant breast surgeon and also general surgeon at Ramakrishna Hospital, Private Limited in Bangalore. And she's also the managing director of Prameya Health Private Limited, which is basically a center for preventive and supportive care. She's going to talk to us about different elements of how a person can take care of their health in a preventive fashion from a wellness perspective. What are the lifestyle changes you have to do? What are the things to take care of? And so on. Not just for cancer, but in general. Dr. Sandhya Ravi is a breast surgeon, as I mentioned, in Bangalore. She has over 32 years of experience as a doctor, specializing in breast diseases, actually. She also is a fully experienced person in clinical trials, which basically shows that she's very fond of new techniques and new treatments, right? So that is when you actually participate in clinical trials. Very few doctors are, adopting newer technologies, and it's great to see ma'am doing that. She's also a strong advocate of preventive health practices and management of lifestyle-related diseases, chronic illness, including cancer. She started Prameya Health, and I will let her talk a little bit more about this institute. But the way we got connected with Dr. Sandhya Ravi ma'am is through her Sahai program, which is primarily providing care and supporting care to women who already have been detected with cancer. So I have attended several of their sessions, very useful sessions held on, I think once a month, every Saturday. And she actually invites experts to guide cancer patients to actually make their life much, much better. Thank you very much for agreeing to be part of this webinar, ma'am, and then agreeing to share your thoughts with our audience. Please take the stage, and please do tell us what Prameya does and how people can be healthy.
Thank you, Geetha, for the very warm welcome. Good evening to all of you. Really sorry about the slight delay in starting this program. Before we begin, I will just give you an overview of what Prameya does. It is a...
share slides.
Yeah, just give me a minute before I share the slides.
Yeah.
Is it seen now?
Yeah.
Okay, thank you. Yeah, so as you can see, we are a Center for Preventive and Supportive Care. And I am a breast surgeon. All of you may be wondering, what is a breast surgeon doing about prevention? How am I involved with prevention? So about 4.5 years ago, I decided with another friend of mine to start this organization because I have always felt that prevention is a very, very important aspect of medical care. Sadly, as doctors, we pay very little attention to prevention. And I thought it is, at least at this stage in my life, I need to focus on prevention, help people understand their body and health and how they can take care of it themselves. In fact, one of the funny things that happens here is we tell people don't go to hospitals and don't see doctors, get well yourself. So with that concept, we started this organization, and slowly we were addressing and building awareness programs for people with non-communicable diseases, the chronic diseases. And then because I'm a breast specialist, we started this program called the Sahai program, which addresses the unmet supportive care needs of women with cancer. This again happened because we as a team, the oncology team, we have medical oncologists, radiation oncologists, psycho-oncologists with us. And we decided that supportive care to address unmet needs is not something that we can do in hospitals, because neither the patients nor the doctors are inclined to or have the time to talk about supportive care as we see it. Practicing breast surgeon for more than 35 years, I have seen that there's a lot more that can be done. It's not just treatment, it's not just surgery, it's not just chemotherapy or radiation, but patients going through a diagnosis of cancer need much, much more to support them through treatment and also in the survivorship. So without further wasting time on what we do, let's move on to the topic for today, and that is preventive health. Awareness is empowering. So over the last few years, what we've been doing is these awareness programs, and we found that just by increasing the awareness, a lot more action can be taken in preserving health. I'll start with a small story, a very favorite story of mine, which actually fascinated me when I first read about it a few years ago, maybe about 5 or 6 years ago. And this is called the Blue Zones story. I don't know how many of you would have heard about the blue zones. I mean, we all talk about red zones and green zones, especially now with the corona. But there is this small island in the Aegean Sea off the coast of Greece. It's a Greek island called Ikaria. And the story is about a war veteran, a Greek war veteran who moved to America and settled down there in the late 70s. He had his own, he was a war veteran, so he was not financially well off, but he did grow some business. He got married, he had 3 children. And then when he was just about to retire, he was diagnosed with lung cancer. And several of the tests revealed that it was very advanced lung cancer. And the doctors told him that he would not have more than 9 months to live. So he was debating between staying back in the US because his children were there, or that he would move back to his roots because he was a Greek person. He wanted to move back to his little island off the coast of Greece called Ikaria. And he said, whatever few months I have, let me spend it there. And he came and he spent his time there with his parents and his wife. And slowly he started doing things that he could do. He was just waiting to die. Then he slowly found that he could walk up to the church every day, attend a service. Then he started tending his garden. And 6 months passed and he was not dead. He started eating better. His childhood friends knew that he was there back in their country, so they came to visit him. Slowly, he started growing his garden better. He started harvesting the produce. And years went by, maybe 2 years or so. And he was alive and well. And this journalist who traced him, he's from the National Geographic, called Dan Buettner. And he was studying islands of people where they live a very long time. And he found that 35 years after diagnosis, he was alive and well. And the funny part is this man went back to the US to look on his doctors and tell them that, look, you gave me 9 months to live, now I'm alive and well now. And sadly, he found that his doctors were dead. So what is this all about? It is that there is something beyond medicine which we can do to assure our health and well-being. And so that is the importance of preventive. So it's all about making health and wellness your priority and what anticipatory steps you take to ensure that you can prevent disease. It could be health, it could be disease, it could be disability. But we must understand that it's useful only if it's applied dynamically over time. So the scope for prevention is immense, as you can see from the green bubble. But what we are doing now is reactive health. We can't blame it because our healthcare system is like that. If somebody falls down, breaks a bone, we have to attend to it immediately, right? And not really many people are bothered about immunization or, leading a healthy life. What has happened now is this pandemic of the corona has made us think, what is preventive care? Actually speaking, prevention should be everybody's business, right? From the government to the corporates to the governing bodies and so on. But what has happened is now, if you look, everything from laddus to cereals, everybody says immune boosting. So they are all getting to the preventive care business in the wrong sort of way. So I feel what we need to understand here is, although it's everybody's business, nobody focuses on it. The corporate hospitals, the healthcare system, sadly, does not want to spend money on it because there's really no return in terms of the money return. So each one of us is responsible for our own health and we've got to take care of it. I want to tell you a little bit about prevention and how we look at it. All of you are familiar with primary, secondary, and tertiary prevention, but there's also this primal and primordial prevention that you must be aware of. Primal prevention starts in the fetal environment, just even before birth, where we take care of the mother's nutrition, reducing the mother's stress, the life of an individual all along, until death. And then this primordial prevention is something that we are talking about during the development of a child. An example here is the vicious cycle of childhood obesity. So there's this healthy child, but then because of the modern day technology and the lifestyle, watches television, plays video games, all study, no games to play outside. Then you get a mildly obese child who desires to eat junk food, working parents indulge. Then you get a moderately obese child whose extra weight is by 10 kgs or 15 kgs overweight. And then you have the severely obese child who's completely predisposed to diabetes, hypertension, metabolic syndrome, and the whole works. And then, of course, you know the story of what can happen with an obese adult. So primary prevention is basically what we are doing: health education, lifestyle changes, modifying the environment, giving nutritional advice. Of course, all our immunization, the childhood immunization, the vaccinations that we take for diseases which are epidemics, which happen on and off, all come under primary prevention. Next is the secondary prevention, which is what most of the people do, and what we do at Prameya as well. The majority of our work is on that. It is to stop a disease currently without symptoms from turning into one. In fact, what Niramai screening is also part of that. So screening programs for breast cancer, and then other health checks which people undertake at hospitals like master health checkups, all of that comes under secondary prevention. And tertiary prevention is once you have a chronic disease, say like arthritis or chronic lung disease or whatever, how you can prevent the further progression of the disease or reduce the effects of the disability causes. Looking at some statistics, if you look at the growing numbers, the projected population in the year 2021, the majority of the people are either in the 60 years and above age group or the 15 to 59 age group. Basically, they are in the 15 to 59 age group, but there are growing numbers in the 60 years and above as well. So you can imagine all of you know that most of the diseases crop up during this time, whether it's cardiac disease because of hypertension, diabetes, whether it's asthma, whether it's cancers, whether it's depression, all of this comes at this time. So we have to look at some facts. The overall life expectancy has increased. Women are living longer than men because of the improved medical systems that have come up, better diagnostics, better treatment modalities. The Indian healthcare system has taken tremendous strides. So we know that maternal mortality has fallen from 57 to 1,000 to only 28 per 1,000, still can improve. And generally, what we notice is women's health receives attention only during pregnancy and childbirth, and maybe during lactation. After that, both the women, the family, and the medical fraternity forget about them. So I want to tell you about the study, which is the Women's Health Initiative. It's the longest running study. And it started in 1991 in the US. And it's enrolled more than 160,000 patients, postmenopausal women basically, and who are in the age group of 50 to 79. And what they are looking at is how the prevalence of heart disease, breast cancer, colorectal cancer, osteoporosis, etc. And what was the information that came out of it was that there are health conditions that are specific to women, and they are more common or serious in women. And they have distinct causes of manifestation in women, and their outcomes are also different, or they have a high mortality or morbidity in women. So basically what we are trying to say is there is a difference between the way some diseases affect women and some diseases affect men. What are the emerging challenges in India? Women constitute 50% of our 1.3 billion population. They have a higher burden of disability because of non-communicable diseases. I'll be telling you what that is about. And also like back and neck pain, depressive disorders, respiratory diseases, high rates of sexual violence still persist. And most NCDs are caused by high-risk behaviors. And what are these? It could be smoking, drinking, obesity, bad diet, etc. So by educating this group, you can actually bring in very impactful changes. The gender disparity is something that we must pay attention to, because a lot of conditions happen in women. They pay less attention to it. And if you look at it, majority of the healthcare delivery people are also women, like the nurses. For instance, in my practice, I've seen the nurses do such a great job, but they hardly pay attention to themselves. They hardly get themselves screened or tested until they really become sick. And overall, there is this apathy and ignorance. They think that nothing can happen to them. And although there is, if a woman, there is equal risk. If you have hypertension or if you're a smoker, the equal risk of cardiac disease between women and men. But if you're a diabetic, the risk of a woman getting a heart disease is much more. So by removing all this ignorance, by learning and teaching people to, address their own health issues, I think we'll go a long way in building a very healthy community. So the root cause and the shared risk of all this is only 4 major things. Physical inactivity has been proven beyond doubt. Alcohol abuse, tobacco use, and unhealthy diet. So that can lead to plenty of, a spectrum of diseases, from heart disease, stroke, diabetes, cancer, chronic lung diseases, depression, mental health, all of that. Younger people are affected, and majority of these illness and death due to these are called non-communicable diseases because they don't pass on from one patient to another, and they're chronic. They're not, they're there to stay. But they can be delayed or prevented if you control the risk factors. So this slide, if you all can see, shows all the risk factors on the left-hand side: smoking, tobacco, alcohol, nutrition, bad nutrition, physical inactivity, raised blood sugars, blood pressure, obesity, and raised cholesterol. And look at this, the cardiovascular disease, diabetes, cancer, and lung diseases. All of them are caused by these factors. As women, we're constantly doing a hormone balancing act. Coming to the women's aspect, women's health is the topic for today. A woman, as you know, goes through several phases in her life. Adolescence, goes through regular menstrual cycles or irregular menstrual cycles, goes through pregnancy, goes through lactation, goes through menopause. And all of us are aware of the havoc that the hormones can play during this time. Look at this. We now know that majority of this hormonal imbalance problems are related to a single cause, and that is insulin resistance. Insulin itself, as you know, is a hormone released by the pancreas. But look at the symptoms: fatigue after meals, migrating aches and pains, obesity, high cholesterol, low thyroid, polycystic ovary, very common now, almost every other person has it, constant hunger, real inability to lose weight, and craving for sugars. I'm sure all of us will have one or the other of these symptoms. How does this happen? You all heard, right? Your mothers or grandmothers saying it wasn't there during our time. What's happening? So I think all of you must be aware of what we call as hormone disruptors. Now we know as women that estrogen plays a very, very important part in our lifestyle and everything that happens to us. So there is something called xenoestrogen, which is there in the environment. We have pollutants everywhere, all around us, in the air we breathe, in the water we drink, in the food we eat, and in the products we use. So what are these xenoestrogens? Xenoestrogens are the chemicals that are found in all this contaminated soil, in the food packaging, in industrial chemicals, in common household items like plastics, all the chemicals that we use at home, then some cosmetics, some medications. So they act like estrogens and they bind to the estrogen receptor and they mimic estrogens. So the body is tricked into thinking it has more estrogen and it will behave like it has all the estrogen. So we have to learn to minimize the use of these products. So like I told you, it isn't so many of these things. The next important problem that women are facing today in India is diabetes. We know that India is called the diabetes capital of the world. India has a population of 1.3 billion, but 60 million out of those are diabetics, and a large proportion of them are women. You must know that the Asian Indian phenotype is unique, and that's why the risk of diabetes is more for Indians. So if the incidence of diabetes is more, So also gestational diabetes, the diabetes which happens during pregnancy, is also very, very high in India. Also because women try to delay their time of childbirth, they become older, they are at risk naturally for diabetes, type 2 diabetes, and pregnancy at this later age also is a risk for type 2 diabetes. So if the mother is type 2 diabetic or is a diabetic during pregnancy, predisposes the children also to becoming overweight, obese, and lots of pregnancy related complications also happen, like high blood pressure, large birth weight, obstructed labor, etc. The next thing is mental disorders. Now it's coming to the forefront that this is a non-communicable disease, that it is widely prevalent, and we need to talk about it. We have to ignore the stigma that was associated with it all along. And I am very happy to say that preventive
Ma'am, can you hear me, guys? I think there's a problem. Sorry, there seems to be another outage. Today it seems to be a real, okay. So I'll try and get Sandhya back. Sorry about this. She's connecting. She also had a power outage. Sorry about that. No, actually what happened, the reason we started late also is because, Ashwin, who was trying to stream to Facebook Live, also had a power outage and none of us had the credentials. So we're trying to sort of get that going online. Okay, Dr. Sandhya is back. I have paused the recording, so that's fine. Yeah, can you share the slides, ma'am? You are muted as well. Meanwhile, I would like to announce that if you have any questions so far, based on what she's described so far, you could either put in the chat here, or if you are listening on the...
Yeah, can you hear me now?
Yes, ma'am. Maybe you can put it on share screen. So if you're listening on the live Facebook Live, you can also chat there. And I think Ashwin has shared another link for posting anonymous questions, if you like, if you don't want to reveal yourself.
Yeah, can I proceed?
Yeah. So just want to announce again that if you want to share any questions and if you're able to see it on Facebook Live, please use the app.sly URL that has been posted under the Facebook Live page. And you could also, if you are watching it on Zoom, please post it on the chat. Yes, ma'am, please continue.
Okay, sorry about that. This is really the problem with the online sessions. Yeah, so we need to do something about mental health is what I was saying. But now coming to the major health problem that we are going to talk about is breast cancer. As women, all of us are really petrified of it. Although only, I must tell you as a breast surgeon, I keep reassuring people who come to me for preventive health checks, although it's only 10 to 15% of breast problems are actually cancers. 85% are non-cancers. But we still worry about the 10 to 15% because we need to detect it early in order to, cure it. And I'm very happy to say that, over the years, we've seen the treatment for cancer evolving, and we are in the process of improving early detection, paying attention to the proper treatment protocols. Women are reaching out, quicker, and survival has really improved. So our supportive care program is addressing quality of life issues, because a woman who's been diagnosed with early breast cancer and detected early can actually hope to live a full, normal, quota of her lifespan, whatever the average person has. And but what we're seeing is, because they're living long, there is also this fear of recurrence and things like that, and that is what needs a lot of supportive care to make sure that they're back to normal. And what we're going to talk today from an awareness point of view, I'm not getting into the depth of breast cancer and early detection and all those, breast self-examination. We'll probably see that a little later. But what I want to point out today is that we've got to understand why are we seeing more number of breast cancer cases, and what we can we do something about it. So clearly it has increased because modern life has changed. Women are living longer, so we have to understand what is this breast cancer risk about. If you look at whatever you're seeing on the screen in front of you, you can see that the risk increases as we grow older. I have seen people coming and telling me, I am now 59, so I am not going to get breast cancer. But actually the risk increases after that. So up to the age of 24, it is 1 in 15,000 or 16,000. But as we grow older, when you're in the 40s and the 50s, it becomes more common. It's 1 in 52. Then it becomes, in a decade, it jumps to 1 in 22. Imagine, that becomes even more common. And by the time you're 69, it becomes 1 in 14. And when you're 79, it becomes 1 in 10. And after that, it's 1 in 8, whatever is the classical thing that we read about. But what is worrying for us in India is because we're seeing people in much younger age groups. And the rising number of breast cancer cases in India is also alarming, really. In some of the places, we're seeing late presentation. They come in a locally advanced stage. People don't, I still have women in the 60s and the 70s age group because they don't want to think about their health, right? They think it's not the priority. So they don't even tell their family members that they have a breast lump, and then they come only when once it's too big, or it has destroyed the skin over it, and in the locally advanced state. And of course, there is still lack of awareness. We're still not doing enough breast cancer awareness promotion or screening promotion. And we're trying to do that through Niramai, through our talks and our programs, but still we hope that at the end of this talk, what you will learn, you will please go and talk about it to others. And what is happening in India is we are seeing more number of what is called triple negative breast cancers, which are aggressive cancers, and they occur in the young. And generally, the cancers which occur in the young people tend to be aggressive, probably because we still haven't figured out how best we should treat them. But things are improving. Let me reassure you that with every day, protocols are changing, we are improving, and early detection and better treatment is happening. So this is exactly what I was speaking to you about, the age-wise incidence. 25 years back is what you see in blue. 25 years ago, it was more common in the 50 to 60 and the 60 plus age groups in India. But presently, if you look at the 40 to 50 and the 30 to 40 age groups, you can see the red blocks. That is what are the younger population who are having breast cancer, who are presenting with breast cancer now. So let's look at why this is happening. We've got to face reality, right? Puberty and breast development are starting earlier and earlier. Have you given a thought to why that's happening? One of the important things that epidemiologists have studied and found out is that there's better nutrition. Definitely better nutrition. Someone shared with me a picture of people walking in Gandhi Bazaar in the 1960s. All of them were slim, with long hair, and busily walking around. Very few cars, maybe one bus, maybe one car. There were people cycling. But you look at Gandhi Bazaar, same place in Bangalore today, there are people who are obese, who are already in cars and scooters and lots of vehicles around, very few people walking. And all of them, if you see, on an average, everybody will be nice and plump. It may also be because of the hormonal additives which are added to our foods for increasing production. So that's a completely different story altogether. We won't get into that today. Second is more women are delaying pregnancy or not having a full-term pregnancy. We all know that the age of marriageable age has really gone up beyond 30. And even if they do get married, then they want to settle down their career. There's things like sperm banking, ovum banking. All of that has come into vogue, and things are happening even in India as well. It's not just a story of the West. Fewer women breastfeed or don't feed long enough because they have to rush back to work, or just that the concept of breastfeeding is not attractive enough. More adolescents and women are taking prescription hormones. Like I told you, PCODs, that is polycystic ovarian disease, is very, very common. So that is again because of a massive hormonal imbalance that is happening. And a lot of women take postponement pills, the eye pills, and then pills during menopause to combat symptoms. And more women and girls are overweight or obese. We are less physically active now. I see a lot of youngsters consuming alcohol. It's the in thing. You're keeping up with the times, peer pressure, lots of pubs around, and it's stylish to do all those things. A lot of women smoke. And vitamin D, of course, is another big epidemic which is there. And of course, we are exposed to a lot of pollutants, both in our house, in the environment, and don't even speak about stress and sleep deprivation. It's so common. So when women ask me, what can I do for cancer prevention? There's really nothing much, It's the building blocks of good health always. All to do with your diet, how physically active you are, how you can manage weight. Because it's beyond doubt, a lot of research has proved that increasing in weight predisposes to breast, ovarian, endometrial cancers, colorectal cancers, all of which are quite common in women. So we must pay attention to that. Those are the things which we, as a basic thing, we must be aware that this is what we have to address. Of course, I cannot talk enough about screening. Out if you are in the high risk or moderate risk category, and get yourself aware of your breasts. That is, you must know what is happening, what are the changes which happen in your menstrual cycle, so that you know what is normal for you. And you can go and seek advice when you have a slow loss first of muscle mass and bone strength. And then there's a rapid loss from the ages of 50. So that is where you start getting neck pain, back pain, low back pain, knee pain. And that is why you have to take preventive action from the age of 20. So exercising regularly, maintain a correct body weight. So according to the WHO, being healthy is as easy as ABCDE. Avoid alcohol, be physically active, cut down on salt and sugar, don't use tobacco products, eat plenty of fruits and vegetables. So when we say be physically active, it means at least 30 minutes of moderate intensity activity 5 times a week. And you can break this up if you don't have time. I know a lot of housewives also say that they don't have time or they're not motivated enough to go to the gym. Be active at home. I think the COVID times have made everybody do their own housework, which is a very good thing. And you can also break this up into 10-minute high intensity exercises, which are equally, if not more beneficial than a 30-minute moderate exercise. So basically the lifestyle changes that we make today are the ones which are going to tell us whether we are going to be healthy or we are going to get into disease. So the foundations of good health are, like I said, nutrition, physical activity, and most importantly, the state of mind. So our physical health depends on the environment above us. We spoke about that, how to avoid pollution and all those harmful chemicals, and improve the air that we breathe and what we put into our bodies in the form of food and drink. And also there's something called the inherent immunity within us and the resistance and the resilience within us. We have to work on that. That depends on our state of mind. All of it gets affected by, a lot of stress that we face either at home, at work, financial stress, and so on. So we've got to make some attempt to work on that. And as families, if we can inculcate the importance of these three things from the very beginning or very early age, it's a wonderful thing. And one of the plus points that I see of this lockdown period is that we've all had enough time to spend with each other at home in a very meaningful way, lots of meals being had together, and also probably attending a lot more informative webinars and useful information. So basically, we're coming to the end of my talk. And what I want to say is, whatever the lifestyle changes you make today can lower your risk. So every time you eat, drink, or use a product, you think twice. And is it really healthy? Stop taking extra hormones. Make sure that you are able to maintain a healthy weight. It's not necessary to be stylishly thin. It has to be all about flexibility, strength, endurance, and being in the correct BMI. So limit alcohol use or don't use it at all. And definitely stop smoking. Avoid second-hand smoke, third-hand smoke, and all of that. So start now. You can believe in yourself and lead by example if you do today. One person does it, you can influence the second person you're friends with or your home, the people at home or at work, and you can really lead by example. So these are all the things, all of you can read the screen, often stated. As a medical practitioner, I would say, please get your vitamin D checked. Get enough of vitamin D. Go out in the sun, because we know that it is very, very protective, and it's very important for a lot of metabolic activities within our body. And look at the way you package and store food. We advise at Prameya, we advise everybody to shift from plastic, whatever it is. It may be, that high-class plastic. I'm not getting that word, whatever. The one which is supposed to be safe. Those products which, like the marketing strategy. Pardon?
Tupperware?
Tupperware, yes, thank you. Yeah, the Tupperware. So even if it's Tupperware, I would suggest that you move to storing things in good old stainless steel and glass, which you'll really go a long way. And also use green household products, lots of stuff on the YouTube about how you can make your own cleaning agents. Grow your own food as much as possible. We regularly encourage our cancer patients to grow their microgreens so that at least some part of their meal is fresh, pesticide-free, pollution-free. And it's interesting, exciting, it gives you something to do and a feel-good factor as well. So these are some things that we need to think about, so that we are empowered with this knowledge about the disease and the risk factor burden. Can you see my video again?
Yes, ma'am.
Yeah. And this amount of being empowered and knowledgeable about this can be absolutely transformative to the health of the woman and the entire families. Because as we all know, if you change a woman's life, you change the family's life. So coming back to my favorite story of the blue zones, what they found out was, if you can start creating a healthier, happier life today, because by making healthy choices, they become easy choices. You have to downshift, you have to slow down, you have to find stress relieving strategies. Wake up with a purpose each day. All of you will be familiar with Ikigai. I don't know why other countries have to tell us all of this. We can do it ourselves. We can surround ourselves with people who support positive behaviors. We can be part of a faith-based group and meet at least once a week. And today, you can take the personal pledge. Today, at the end of this webinar, you can take a personal pledge to eat a largely plant-based diet. Need not be completely, I know it's difficult for some people to change, largely plant-based diet. You follow the 80% rule. Eat mindfully and stop when you're 80% full. Because as a race, as a civilization, we have seen that we are eating far too much. Even if we eat a small quantity vegetarian meal, what we think of at our homes, we are eating far too much. Move naturally, find ways to move naturally, do things at home, what we call non-exercise thermogenesis. So those are things that we do at home, sweeping, swabbing, washing dishes, all of that burns calories without thinking. And always find time to meet friends, eat together. So, being in a group, being in a positive thinking group, like-minded people thinking the same things about their health, paying attention to these small changes can have a huge impact on your lifestyle and the prevention of disease. So I want to end with this note saying that health doesn't always come from medicine. Being a doctor, I know that. Being a cancer specialist, treating women with breast cancer, I know that. Because I don't make them happy just by operating on them or treating them for their cancer. Most of the time it comes from peace of mind, peace in the heart, and peace of the soul. It comes from laughter and love. And that was the reason we started the Sahai Fence, that is the functional, emotional, nutritional, and spiritual cancer support program to address the
Lost. We lost her again, right? Hello?
Yeah, I'm here, Geetha. I've stopped sharing the screen.
Oh, okay. So thank you very much, ma'am. It was a wonderful, wonderful session. I think even the audience wouldn't have felt that it has been delivered by a super specialty cancer surgeon. Yes, she is. And the thinking of prevention basically means reduce number of patients to the doctors, but that doesn't sort of it clearly shows and so many tips and so many good advice on different fronts for both women and men, that can be followed. Thanks a lot. This was extremely valuable. First, before I go on to the pre-submitted questions, people on the Zoom call, do you have any questions you want to ask first? First preference to that. Any questions? Hello? No? Okay. So let me go to the submitted questions and make sure that gets answered. Obviously, many of them are submitted before they actually knew what they were going to hear. So I will give lower priority to them and then talk about, ask questions which are related directly to the topic first. Okay. So there is a question which is upvoted by 4. It says, what home remedies can act as preventive health measures? So anything on the natural medication and home remedies that you think will help, ma'am?
Yeah, so home remedies for prevention of breast cancer specifically, or anything?
Anything that you can provide.
So what we know from recent research is we don't have enough evidence base to actually say do this, but we know from recent research that a lot of our Indian herbs and spices that we use at home, like ginger, turmeric, cumin seeds, mint, all of them have a lot of antioxidant protective properties. So we encourage basically what we've learned, and there is one study which showed that the spices that we use in making our sambar and rasam powders are actually protective for colon cancer. So you can understand the wealth that we have in our kitchens. So that's why I said go backwards. Experiment with pizza, pasta once in a way. But we have a wonderful store of naturally protective ingredients as Indian, as part of the Indian culture and the Indian cuisine. We should go back to that, resort more and more to simple home cooked meals with juice, all these products. which can really play a large part in improving our immunity. The tulsi leaves, the dodapatre leaves, that is the ajwain leaves, are extremely useful in this period, especially to prevent cough, cold. In fact, I know of a pediatrician who regularly tells the mothers to just make a concoction of tulsi and dodapatre. So they are shocked when they see that the pediatrician is not prescribing, writing out a cough syrup, but saying this. So those are things that we must go back to using. And I think, in all our websites and social media posts, we do promote these things. We just tell them that these are useful, but they're all based on some scientific research. Although we don't have it's difficult to do large evidence-based studies, especially in the area of food, because as you know, every 10 years, the fads keep changing. So that's why from a prevention point of view, I want people to focus on only simple things. Fresh, home cooked, pollution free, those kind of things we should base our judgment on.
Okay, very nice. Thank you, ma'am. There is a question posed on the chat. You mentioned about empty calories. So Vandana is wondering what it is.
Yes. So empty calories are all this, what you find in Coca-Cola, what is that, Pepsi, then also a lot of sugar, because it just goes off as calories. It just gets burnt. It has no nutrition in it. Anything without nutrition, which has no nutritive value, is an empty calorie. Okay. So if you may ask, even water has 0 calorie, but is it empty? It actually fuels your body in some way, right? Water is very important. But any of those other drinks which have loaded with sugar, but water does not have any calorie, it is a truly 0 calorie useful drink. But any of the other loaded with sugar drinks that we see in the market today, all those Tetra packs of even this, what is that, organics and those kind of Tropicana and those kind of things are filled with unnecessary empty calories.
Okay. There's another question. Is it required to have supplements like calcium, vitamin D, multivitamin tablets after the age of 40? You mentioned about vitamin D going out in sun. But are there some supplements that women above 40 years of age should take?
Yes. So when it comes to supplements, there's always a mixed view. And personally, I feel when we recognize a deficiency, we must take a supplement. To prevent a deficiency, if you can get it sorted out with healthy diet, that's the best way. But there are certain things like vitamin D. We don't have that much fortified food in India. In the West, there's cereals, milk, all of that is fortified with vitamin D. So you may get enough. In India, we had the sun, but unfortunately, we are all working in air-conditioned offices, air-conditioned cars we travel in. Also, the youngsters use loads of sunscreen and stuff like that, a lot of makeup. And also the clothes we wear. We know we don't expose enough of our body to get the absorption of from the sunlight. And only now, I think Nandini has started fortifying their milk packets, which is provided in the sachets with vitamin D, but that's not enough. So until we really get enough fortified vitamin D from foods, it's good to test ourselves because, earlier I was also very skeptical when initially, several years ago, maybe 5-6 years ago, when we started testing vitamin D for everybody and we found that it was only very, very low, below 8. I thought it was one big racket. Until from personal experience, I realized that it can happen to even doctors and other people who are talking about it. So it's important to get ourselves tested and correct it. So vitamin D is important. From the age of 40, calcium supplements, if you're eating, like I said, a good balanced diet, and please don't be under the wrong impression that milk is giving you loads of calcium. There are lovely varieties of vegetarian foods like sesame, yellow. Yellow has, a tablespoon of yellow has, that is sesame seed, has 9 times more calcium than a glass of milk. But unfortunately, we can't eat yellow so much because the absorption also may vary and, it also can cause a few side effects in some people. So you can drink, you don't have to drink loads of milk. You can have green leafy vegetables. Palak and soppu is very rich in calcium. So you can try out with different dietary changes. But if you do think, or if you are tested for osteoporosis, you find you don't think, then it's important for you to take a supplement. In times of need, we have to take a supplement. So like women who are pregnant, we give supplements. After delivery, during lactation, we give supplements. When you recover from illness or surgery, we give you supplements because those are times of demand. And now this corona time is a time of demand. All of us need to have that little extra bit. So we are prescribing zinc and vitamin C and vitamin D to everything.
Okay.
But otherwise,
Eat
a good
vegetables.
balanced diet and a healthy lifestyle is enough to take care of your needs.
I think that's very key. There's a question asking if there's any standard recommended minimal set of tests that needs to be done every year, like blood test and ILAD, cancer screening test. So are there certain minimum tests that women need to do every year?
Yes. So as we grow older, from the age of 40, perimenopause, I like to call it. So menopause is not just, doesn't happen in a day overnight, right? So it's a buildup which happens over a few years for some people almost over 10 years, for some within 2 years, 3 years. So when you start sensing those changes, it's important that you have regular checkups because your body is going through a lot of hormonal changes. You become hypothyroid. So it's important to test, your metabolism goes down. Important to test your thyroid, important to test your BP, your sugars, your cancer screening, especially for women, the breast, the ovary. So have an abdominal ultrasound, have a pap smear, do a breast self-examination, do a simple non-invasive breast screening like the Niramai screening tool. And with that, it's very easy to do it. And these are things that we must pay attention on a regular basis. So I recommend all women after the age of 30 to go into, to learn to practice breast self-examination. And depending on your risk, if you can get a clinical breast examination done by a doctor and also determine your risk, then there is no low risk for breast and ovarian cancer, by the way. It starts with average risk. Okay? If you have a breast, you are at risk for breast cancer, both men and women. So there is no thing as low risk for breast cancer. It starts with average risk. So you need to get yourself regularly screened. So these are the tests that you'll do. You'll check your BP, you'll check your thyroid, you'll check your sugar, you'll check your renal function tests, and you will get your breast screening done and your pap smeared on a regular basis. At least once a year, make sure you get all these things done.
I think that's very good. Yeah. So the other thing is about, there are a few questions about, particularly about breast cancer. And this is anonymous, and I think many women may have it and they may be feeling shy to ask this. How risky is it for a woman with bigger busts for cancer? So
bigger breasts themselves are not risky. The only risk may be that it may be difficult to do a breast self-examination if you have a very large breast. The second thing is breast density is what matters. So when you get an ultrasound or a mammography done, we will be able to judge the breast density. So if it's not a very dense breast, then the risk is average like anybody else. But if you are showing your breast density is higher, then the risk proportionately goes up. That's the only risk that is there. Other than that, just having large breasts per se is not a risky thing. Just the difficulty of learning to do a proper breast examination maybe.
Yeah. So we are talking about self-breast examination in multiple forms, and there are a few questions about it. We will be playing a small animated video about how to actually check your own breast regularly every month. Usually choose a day, fixed day, and then do your self-breast examination on that day. Of course, also go for Niramai screening regularly. So even without symptoms, we're able to detect early stage abnormalities. So before we get on to that, there are two questions about managing hereditary thyroid weakness and controlling BP. So after that, we move to the self-breast examination.
Yeah. So the hereditary thyroid problems are probably related to some metabolic problem or a hormone, what we call as a inflammatory autoimmune problem. So these things with early detection, with early supplementation can prevent an onset of a full-blown thyroid problem. Other than that, Earlier, we used to see big thyroid swellings because of iodine deficiency that we've really taken care of. When I was a medical student, we used to have a lot of people coming with huge thyroid problems in the front of the neck. And that was largely because of iodine deficiency. They were not using iodide salt. Then the government of India started fortifying salt with iodine, and we overcame that problem. So the first and foremost, like I said, is to identify thyroid problems at the time of need. So as a girl is growing up through adolescence, through puberty, then soon after delivery, those are all times of need when thyroid problems can crop up. So we need to do those tests at that time and correct the thyroid deficiency. So other than that, hereditary thyroid problems per se are not very common. And if we can recognize the problem early enough and give them the supplements, there shouldn't be an issue. And what was the second question, Geetha?
BP, blood pressure, high blood pressure.
High blood pressure, if it is a essential hypertension, most of the time, 95% of the time in India, it's because we are consuming too much salt. Indians, as a civilization, are really prone to having too much salt. We want too much salt in our foods. So we've got to learn to reduce that. In anything that we package foods, too much salt. Even on our tables, pickle, papads, all of that, try to reduce your salt intake by quarter, spoon every time. And slowly you will find that you're at half salt and then you're at quarter salt, and anything little more salty, you just can't. It's a matter of getting used to it, but that's how we'll have to tackle that. So that's the only thing for the BP. Of course, if you have a kidney problem and things like that, those may also be related. If you have a congenital kidney disease, that may be related to a hereditary BP problem. But most of the times, we think it's hereditary because the whole household is eating that salty food, right? From grandfather to father to, so they think it's hereditary. You change the food in the house, everybody's BP will.
That's nice. So we'll move on to the self-care video, but I guess there is one more question from Sahana. Should we take medication to combat menopausal mood swings and other problems? So menopausal, you talked about premenopausal, perimenopausal. So are there any medications on that are needed for mood swings?
Yeah. So your mood swings during menopause is very, very common. The family has to be understanding. The woman has to be aware that it's because of that. They should have a frank talk because, a sudden burst of anger and things like that, you can't avoid, right? However much you practice yoga, pranayama, things keep happening. In terms of medication, of course, there have been supplements which have tried like evening primrose oil, vitamin C, cranberry capsules, all of that, vitamin E. But omega-3, I have found in my patients, and also there are studies to prove, is very good. So a natural form of omega-3 or in the form of fish oil and some supplements can be taken at this time. The second thing is practicing breathing, slowing down your blood pressure and practicing pranayama, learning it from a trained person is very, very important. Because 3 or 4 times a day, if a woman who's going through menopause can do short spells of 5 to 10 minutes of breathing, it really helps in these mood swings. Of course, if it's very, irritating and the person is not able to manage it, we do advise some short-term medication, either in the form of anxiolytics or even a little bit of hormone replacement therapy for a very, very short time. But it has to be done under the guidance of a doctor. Otherwise, these are things that you can try from a preventive aspect.
Yeah. Thank you very much. There were actually many questions about Niramai test as well. I encourage women, all the audience to go to niramai.com. There were questions about, tell us more about home screening. And please go to the website. You can book an appointment and there you can actually put your phone number and location or city where you are in. Our team will call you up and then fix up an appointment for somebody to come in and do the breast health screening at your place. Nothing is needed, just they will come home and then do it. They will take care of all the COVID related safety, precautions, including wearing masks and sanitizers, and our test is completely non-contact. So, that also helps, and it's COVID friendly, if I can say it that way. So, there were many more questions about breast health. We will, have many further programs. I'm also conscious about the time. So, we will now move on to the video. And once again, thank you very, very much, ma'am. It was an extremely educational and learning, last 1 hour, I would say. And we will definitely call you back for more detailed. And I think we had planned to do some pranayama teaching to the women as well. So we will do a pranayama course as well. So this is going to be a webinar series just for women health. And so let me just move on to...
Thank you, Geetha, for this lovely opportunity. I always love to speak about prevention and breast health. Thank you very much.
Thank you very much. And I encourage all the audience to sign up to our YouTube link, YouTube channel. You will hear more and more information and announcements about newer webinars that we are planning to have, and so on and so forth. Stay tuned. And now, please watch this video very carefully. Practice this once a month, very regularly. Fix up the date and practice this, preferably between your menopause cycle, in the middle, or maybe 5 days afterwards. Okay, so I think we're able to see that. And this is also available on Niramai YouTube channel. Please watch the same, and see you next month, same time. I guess I'm feeling like a TV show. Okay, thank you all. Bye-bye.
Thank you, Geetha. Bye-bye.
Thank you, ma'am. Really, I think everyone is very happy, and they're giving you a lot of acknowledgement on the chat as well. Thank you. It says amazing information. Thank you so much, ma'am. Thank you. Take care all. Bye.
Thank you.